How to give tablets to your baby. This video explains how to give tablets to babies. This information does not apply to giving capsules or other forms of medication. Please note, the images in this video are for illustrative purposes only and do not constitute the hospital's endorsement of a specific brand or product. Some babies may need to take medications in tablet form if their healthcare provider has prescribed them. Since babies are unable to swallow tablets, you will need to crush the medication and finger feed it to your baby. This video will guide you through the process. Please note that not all tablets can be given this way. Only follow the steps in this video if you have been instructed to do so by your child's healthcare provider. Step 1. Wash your hands. Step 2. Gather your supplies. You will need your baby's medication. This may be in the medication bottle or their dosette if you use one. A pill splitter. Your baby's healthcare team will tell you if you need one. A pill crusher. Step 3. Take your child's dose out of the bottle or the dosette. If your child's dose requires you to split the pill, please follow the instructions in the next step. Step 4. Only follow this step if your healthcare team has instructed you to split the pill in half. Place the tablet at the top of the pill splitter. Close the pill splitter. The medication will be cut in half. Remember, only follow this step if your healthcare team has instructed you to split the pill in half due to the dose. Step 5. Place your child's dose into the pill crusher. If you had to split the pill, place the other half of the tablet in a medication bottle or dosette for your baby's next dose. Step 6. Place the lid on the pill crusher, then twist the top of the pill crusher to close it and crush the medication into a fine powder. You may have to twist the top several times to completely crush the medication. Step 7. To give the crushed medicine to your baby, first moisten your finger with water, formula, express breast milk, or your child's saliva. Then dip your finger into the powdered medication to pick it up. The medicine should stick to your finger. Do not forget the medicine on the top of the pill crusher. You may have to do this several times to ensure your baby gets the full dose. Do not leave any powder in the pill crusher. Step 8. Finger feed the medication to your baby by putting your finger into the side of the cheek or allowing your baby to suck the medication from your finger. Make sure you have fed them all the powdered medicine in the pill crusher. It is best to do this before feed so that your baby is hungry. Step 9. Clean the pill crusher and pill splitter, if using, with soap and water and allow it to air dry so it is ready for your baby's next dose. Remember, if you have any questions about your child's dose or how to properly give the medication, contact your healthcare team.